I'm Judy Chen, President of Health Pro Consulting, and our session today is on the post-pandemic consumer. I'm here with Lauren Vella.
Hi, good morning, everyone. I'm Lauren Vella. I'm with the Pacific Business Group on Health. We are a 501c3 dedicated to a higher value healthcare system, and I represent very, very large self-insured purchasers of healthcare, both private employers as well as public purchasers of healthcare.
So, Lauren, 6 months ago, I was here at the December CTEL conference, and one of my question was, why wasn't telehealth option, why was it so low among consumers? And so there were some reasons for that, where patients were not really aware that telehealth was available. The doctors weren't exactly promoting it if they did have it, and it just wasn't top of mind for consumers to use it. So there was really no compelling reason to try it. And employers are wondering, how do they get the employees to use it more because it's a less expensive option? So there were many things that were going on. But now, here we are, 6 months later, the pandemic struck, and COVID-19 made the old normal vanish in just an instant. So the pandemic rocketed telehealth into the mainstream. So it's now the primary delivery method for health, for coronavirus screening, as well as other health issues. Although it's been reported that many people don't go to the doctor anymore. But as far as telehealth goes, there's no going back. The train has left the station, or as I think Seema Verma said, the genie's out of the bottle. So just a quick comparison, MedStar Health in Washington and Baltimore area had 240 telehealth visits in February, and then that jumped to 50,000 in the month of March 23rd to April 22nd. And then another example is the Cleveland Clinic had a very similar jump. They had 100 telehealth visits in February, and that jumped to over 1,200 in March. So that's where we are at. What are you seeing among the employers?
I'm seeing the exact same thing amongst employers. So virtually every large self-insured employer offers a telemedicine platform. They're either offering it through their plan or they're using one of the standalone vendors. There are, a handful of popular ones in the country. And in fact, when they're offering this through their plan, through their health plan, through their TPA, they're also probably using one of those third-party vendors because those vendors have, there are a few that have a large market share of the business. And I would say for large employers, that they started offering telemedicine, for the vast majority, they have this frustration about a lot of what we call the point solutions that they offer, in that really they're offering these magnificent benefits and they don't always get the uptake that they would like, right? However, for the folks who use it, they love it. Specifically with telemedicine, large employers knew that their employees with young families loved it, because to be able to get up in the middle of the night when your kid has a fever and call and have an in-person telemedicine visit, that was one of the highest purposes for its use. So for people who use this benefit, they loved it. However, it was not widely used, as you say, and the numbers that you quote, by the way, are astounding and mind-boggling. So employers are seeing the same thing now, because now, as soon as it became, it was impossible for folks to go to the doctor, and their doctor offices are often closed because they don't have the right PPE, or, they are social distancing. Folks needed access to their doctors, and they started using telemedicine. But here's the big switch. With the exception of some very large integrated delivery systems like Kaiser, for instance, in California, where they had their own telemedicine platform. For the most part, telemedicine was not adequately offered through the health provider directly, right? That was not always the case.
Right.
But now what's happening is people, employees, patients are accessing their providers, their actual treating providers who know them, who treat their chronic conditions. So not only is it an uptake in utilization of telemedicine, which I don't think is ever going to go away, but it's a different way to use it. It's not as much to the point solutions, although yes, there's been an uptick in that as well. But it's also being able to access their treating doctors directly, which is particularly important for those who have chronic illnesses. So basically, I would say we're seeing the exact same thing that you are seeing in the public space. Large employers are seeing as well within their populations.
Well, the good news is that of those who experienced telehealth, 91% had a favorable experience. So that's really good news. And then, there's another study that shows that 78% would say that they would use it again. In fact, on a friend of mine who is both an MD as well as a PhD, now she's not a clinician, but she never used telehealth. So she said she got a call from her doctor saying her appointment had been canceled and they were going to do a telehealth appointment instead. And so lo and behold, she writes to me and says, I can't believe it. It's exactly what you put in your book. It was a great experience. I didn't have to leave my house. It was quick. It was on time. I got what I needed and it was over. She goes, I'd do it again. And she goes, I'd like to do all of my visits this way. Mm-hmm. So I think that's not atypical of what the consumers are experiencing. So now, though, if they're going to be doing more with primary care, is that what do you call that? Extension actually going to be something that's promoted by employers, or do they have to look for the right kind of group to be able to do that?
No, I think that employers are very happy to see now a switch so that folks are able to access their treating physicians. You know, what we know in this country, just generally speaking, is that we don't have the right ratio of primary care to specialist mix, right? We spend too much on specialists, not enough on primary care. There is good literature to suggest that if we spent more on primary care and actually empowered primary care, we would actually have a lower total cost of care. So a lot of movement in this country amongst very large employers who understand this to try to promote the use of primary care. So large employers are doing things like creating benefit designs where the specialist cost share is more than the primary care cost share, or even bringing in these great on-site clinics to have on-site primary care, or having one or two or three or four free primary care visits a year. In some cases, mandating or defaulting to a primary care selection. So there are a lot of strategies underway amongst folks trying to better manage their health plans to really promote the uptake of primary care. So that this pandemic has created a mechanism, thanks to CMS, leading the charge on this, to say, okay, now we can relax some of the barriers that primary care had to working with their patients in this way. This is a good thing. It's a good thing for the healthcare system. It's a very good thing for patients. But bigger picture, it's a systematic fix that we needed to have happen. And so I think employers are recognizing that they do not want to go back. It's not to say that point solutions don't have their place and it's not a valuable ad, and they all have them and they'll probably continue to have them. But accessing telemedicine solutions through primary care treating physicians is a better approach.
Well, the good news is that I think the consumer now views the telehealth visit as a safer visit. And now that the virus has brought up, distancing and no touching, and they're getting used to touching less, you don't shake hands anymore, you don't give hugs anymore, you have to be more than 6 feet apart. So that's kind of a big deal, because now if you go to a doctor's office, then you have to wait. I mean, if it's the way that it was before. And with telehealth, there's no waiting in the doctor's office. So you're in a safe virtual waiting room that's online. You avoid the crowds where you possibly can pick up something from somebody who's sick, whether that's COVID or not. And people are going to be wearing masks and trying to maintain a physical distance. Now, that brings up some challenges, I think, for children, right, for pediatricians, because they're saying that the children are not coming in to be immunized against other, diseases, childhood diseases. And the primary care offices, some of them are still closed, and, some of the smaller ones may not reopen. And part of that is because with the fee-for-service system, right, they're not getting paid. So another thing that's come up is like these waivers that have been like the Family First and CARES Act brought cost-sharing waivers so that people don't have to pay for a test for COVID-19. And then another waiver, which is the 1135, allows, which is a great one because that allowed Medicare to pay for hospital, office, and other visits. So with all these waivers that are in place now, the large employers, they had a choice as to whether they wanted to do the waivers and the cost sharing waivers. So what will happen when the pandemic slows down and they declare that there's an end?
Yeah, that's a good question. So I think that this opportunity to recognize what patients want is really critically important. One of the reasons that the point solutions were the answer prior to the pandemic, as opposed to creating an infrastructure within the primary care setting, is that the fee-for-service system really does not provide primary care practices with the infrastructure it needed because they weren't paid to create infrastructure. They were paid to see and do, right? So they weren't really paid to create an infrastructure to support a robust mechanism to access their patients. So because CMS created waivers saying, okay, you can pay for telemedicine the way you pay for a normal visit, commercial payers have followed suit. Hopefully this will help save some primary care, because the point you make, Judy, is very, very good. Primary care practices across this country are in dire straits, trouble. And what we're going to see happening is we're going to see people who are close to retirement think about retiring. Okay, so that's going to increase the access issue. And we're going to see other folks, I'm going to use this word, sell out to big health systems or to venture capital folks who are going to swoop in and buy these small practices up and turn them into profitable practices. Well, that is going to raise prices for all of us. So the situation we have with our primary care infrastructure, which was already broken because of the fee-for-service system, it was already broken. And now the weight of the pandemic is going to really create a disaster. So there are many efforts across the country, including in California. PBGH, my organization, is sponsoring legislative change to try to save primary care right now, but use this crisis to change the way we pay primary care going forward. And I would say one of the big wake-up ahas for all of us should be patients want to access their doctors this way. So I really appreciate the privacy advocates who have created protections. We need to have protections, right, for privacy and medical information. Absolutely, we need to have protections. But I think that we should all of the patient advocates, privacy advocates, legislators in the country who are really thinking a lot about this should step back and say, okay, when the opportunity arose, what did patients want to do? They wanted to talk to their doctors. And frankly, they didn't care if it was FaceTime, if it was Zoom, if it was a telephone call, if it was, they didn't care how a WebEx. I mean, the patients were not as concerned about that. Now, we need a role for privacy. We need to make sure we're being safe. So when we get back to whatever the new normal is going to be, we want to maintain the telemedicine advances that the pandemic has thrown upon us, which are good. And then we also need to create an infrastructure that makes sense. Right now, CMS and commercial payers are saying to doctors, we're going to pay the same amount for a telemedicine visit. It's totally a parity to a physical visit. We think that's the right thing because we're sorting through stuff and we need to save primary care. We need people to access their doctors. However, is that the right thing going forward forever? Not sure. So employers aren't ready to say, well, that's going to way it could be. What employers are saying is we want to continue to pay doctors to do telemedicine visits, but maybe there should be a mechanism to make sure that we're not paying for every single, I'm calling in for a script refill, right? So we do want to have an infrastructure that supports measurement and accountability, just like we should on everything we do in the healthcare system. And we need to moderate that. But what we need to really hear loud and clear, I know, Judy, this is right up your alley. What we need to hear loud and clear is that patients, consumers, Americans want to access their doctor, and they want to do it in a feasible way. And I don't know if it's going to be FaceTime forever, but it sure is a handy tool for them, and they're using it now.
Yeah, that's great. And so, Will, do you think if the government has been slow moving? I mean, I think it's been incredible the fact that they moved so quickly in this crisis, but that was a crisis that was affecting the entire nation. So, will private industry, do you think, wait to see what the government does? Or do you think that they'll actually, like the employers that you deal with, lead the way and come up with the things and suggest them to CMS?
So employers make suggestions all the time. They have many entities, mine and others, who serve as their voice on these issues. We have a strong advocacy voice in DC and in California, locally and federally, because we have a lot of national employers. So employers are not going to sit back and idly, lose this opportunity. What will CMS hear and do? I don't know. Policymakers are, they have many voices talking to them, not only ours. But I do wish that they would really listen to the purchaser's voice, because ultimately the folks paying the bill are the ones who know how to align incentives correctly. And so, I mean, there are other inhibitors to really great uptake of telemedicine, right? The state, and you guys know this much better than I. You can talk to it more articulately than I can, but the notion of practicing across state lines, that has been a hindrance for some providers in doing this, and then some vendors in doing it. So there are a lot of inhibitors that I think we might want to step back and say, wait a minute. Does this make sense? How do we move from where we were to where we are to where we want to go in an informed and rational way?
Right. I mean, I think that the waivers have just allowed they've lifted so many of the restrictions, like the geographic restrictions of where the patient had to be or where the physician had to be able to treat. And the fact that now they're allowing nurse practitioners, clinical psychologists, social workers, and they can all offer telehealth to their patients and get paid for it. So the access, not just to a doctor, but to the healthcare clinician or practitioner who makes the most sense, is much broader now. And it seems that to step away from that, you're actually they would actually be reducing access to care if they backed up on that. So that'll be an interesting thing to watch, because now the also nurse practitioners and things, they don't need to be supervised directly by the doctor. They're physically present with each other in order to do that. And then, of course, one of the other big changes doesn't not so much with employers, but FQHCs and rural health centers can also provide telehealth services to patients wherever they are located.
Right, exactly. I mean, if you think about it, many large employers are invested in magnificent primary care clinics, and they're multi-state, right? The employers I deal with are multi-state, and so for them to be able to even set up and provide access to their entire employee population from whatever the local clinic hub is. So where they have huge headcount, they put a clinic, and these clinics are doing great work, right? It's really good primary care done the right way, and they have incentives for it to be used. So the on-site clinic is a really great strategy for many, many employers. But wouldn't it be wonderful if they have employees in one state and they have a bunch of folks there, so they have an on-site clinic, it's running well, it's efficient, it's got great outcomes, great patient experience, but then they have in the next state, they have 100 employees or a small sales office or even folks working virtually, in other parts of the country. Wouldn't it be great if those folks could also access the clinic through telemedicine? And again, you have to be able to, so it does mean sitting back and saying, okay, why were some of those rules in place? And how can we intelligently address some of those rules? So that's just, one example, but I think that is one example. I think that is an important conversation. I think the privacy protocol is another important conversation. And I also think another important conversation is changing our primary care infrastructure in this country so that they have the capacity to create do team care, have a telemedicine platform that is accountable, where they can take care, coordinate care for their patient population, as opposed to sort of this rat race of see and do, see and do, see and do. We must move away from this fee-for-service infrastructure, which has not allowed our primary care providers to really form themselves in a way that is in the best interest of their patients.
Right. So they are employers. So are they doing this because they want their employees to have the best care available to them when they can get it, and they realize that access is a problem? Or is part of this because, I mean, everybody wants to save money, but are there areas where they expect telehealth can actually help them save money?
Oh, absolutely. And I mean, here's a very cool thing about healthcare. Better healthcare saves money. That's the truth. Better healthcare saves money. When you have better healthcare, you have faster diagnosis. You have treatment plan established, and it's the right treatment plan established earlier. You don't have duplication of services because you have administrative efficiencies and sharing of data amongst each other. You don't have a lot of low value care being used. If we look at the choosing wisely measures, where folks are doing lots of services that honestly are clinically evidenced not to be providing clinical advantage to the patient. I mean, we know what choosing wisely was physician led. They were very public with, these are services we should not be doing for these patients, but we're still doing those services. Why? Because that's how they get paid. So to your point, what is in the employer's interest? The employer is always interested in two major things: affordability and quality care. And the really good news, those are not in conflict with each other. If we have higher quality care, we will have more affordability in our healthcare system. We will not have as much waste. We will have people getting well better. We will have more preventative care, so we will identify sick people earlier, and we will really be able to surround the sick people. If you look at, of course, we've got the 80-20 principle plus, right? The top 5% of the sick people, if we can surround them with really coordinated care and really take care of them, that's better for them, and it's better for the healthcare system. So I think the answer to your question is, what do employers want to do? Yeah, of course they want to have sustainable costs. Right now, they do not have sustainable costs, and they're very, very concerned. And what they want is better outcomes. They want their employees to be healthy. They want them to be at work. They want them to be productive at work. And there's a lot of good literature to suggest that healthy, happy employees are more productive at work. So everybody wins if we have a better aligned healthcare system with better aligned incentives, including really good, effective, efficient use of accountable telemedicine by the treating providers.
I was reading something that said that some employers are actually, they started doing things to make telehealth services to patients from work a little bit easier. So they do things like maybe having a room where they can actually have a telehealth visit, or they're also maybe waiving the deductibles, but actually places where they can have these visits in the workplace without actually having to, maybe go outside or go, wherever it is that they can get some privacy to have a visit. And maybe there will be places like if they set aside rooms where they can have some of these remote clinical devices, like something that shows the doctor what your heart rate is, and shows them the equivalent of a stethoscope, a remote stethoscope, and some of those kinds of things. So that you end up with, where in the old days, like in schools, where you had nurses that instead of employers, sites wouldn't necessarily have a nurse on site or a doctor on site. They could have some of these things where the employee could take advantage of telehealth and still be able to provide a lot of the things that they would get if they went into a doctor's office. So
oh my gosh,
that was really interesting.
The technology is incredible. I have one really large employer who has a big population in India, and they have a really well-functioning, high-functioning on-site clinic. And they were actually they were having a situation where they could have a sort of a tech person in India with the patient in India accessing the doctor in California. So the tech in India could do things like take a temperature, take a blood pressure, right? Those types of things. But actually the doctor in California was governing some of that care. So, I mean, what can be done? There are kiosks available where a person can go into the kiosk and there's some self-serve blood pressure and, opportunities to sort of at least be able to send some vitals. There is a program in California being led by a really big health system, which is primary care totally virtual. How do they do that? Well, they have relationships with pods. So these pods might be a pharmacy, right? They might be a drugstore. So when the doctor wants to, and also there's remote access at home. So you can have your own blood pressure cuff. You can have digital scales, weighing and sending information in every morning. So they're able to be sort of connected digitally to, sort of barometers of their health at home. And if the doctor wants them to go in for a different kind of reading, can send them to a local CVS or Walgreens or something and get a reading. But the physician and the care team is very virtual. So that's a California endeavor that's happening right now with the large health system to really offer a different kind of primary care where there's this very engaged, interaction that's going on between patients and their treating physician. But you can imagine for a patient with a chronic illness who needs to have very close monitoring on an ongoing basis, it's not realistic for that patient to come in and see the doctor every week. I mean, that's a disruption to their work. It's a disruption to their home life. It's actually a disruption to the physician's office, the kids. And what we're seeing because of our experience, sort of thanks to COVID, I guess, is that this can work on a scaled basis. This is a great opportunity for us to not waste this crisis.
I like your phrase, don't waste a good crisis.
Yeah,
but
exactly.
I think you're absolutely right in the technology being so advanced these days because, they have these kits that you can actually go and buy. I think you can buy one of these at Best Buy. And it's a home kit that you can you use at home, but the catches that the doctor that you are connecting with has to have, the receiving end or of this kit. But it seems like it's less expensive. I mean, and that's kind of key is that can these things come down to the level where you can have your own remote home kit to connect with your doctor beyond just the visit of audio and video. So I think as that comes on, maybe that's something that people get as part of their benefits from when they work is they get a home kit that you can connect with your doctor easily and not have to go to the doctor's office very often. So one of the things they'll have to fix, though, how do you get immunized? Are they going to do that where you can do a drive-by immunization for kids in the car? I don't know.
Maybe. Maybe.
The drive-by thing has really been interesting to see. And we weren't the ones who invented it. They developed that in South Korea during the last SARS disease that they had. So I think that one of the things that patients, now that they see the telehealth thing as a safer visit, and the fact that they won't want to go in often, will they be? I think part of their expectation is that the cost of healthcare, the premiums, should be going downhill, and that it shouldn't be staying at the same level that it is. Employers who self-insure, will they see that as well?
Well, right now they're seeing it for sure. So, the healthcare, there's a lot of avoided and deferred care going on at this very moment. Healthcare costs are actually down. Now, the conversation is how much of that deferred and avoided care, how much of that care is deferred and how much is avoided. So will we see all the deferred care piling on when the healthcare system is up and running again? And will we see a lot of that avoided care not happen? I was talking with a large one of my large members recently, and we were talking about this very thing. And, it's really interesting. ER use and urgent care use is really down, but the folks who are using ERs and urgent care are not they're not dying. So that suggests that maybe a lot of those ER visits and urgent care visits weren't necessarily necessary, right? I mean, we don't want to discourage people from using the ER and urgent care when they need to use the ER and urgent care. But maybe what we're seeing, let's not waste a crisis, maybe another thing we're seeing in this pandemic is that a lot of that use is not necessary. If there were really well-functioning telemedicine that were available to people in a very easy way, and they were accustomed to using it and comfortable using it, maybe that will allow us to continue this trend of not going to the ER and to the urgent care. So I think telemedicine has even a bigger role to play here than we know. Not only is it about enabling people to access their doctors better, which is great, but it's also maybe we can when it becomes second nature for people just to use telemedicine instead of going to the ER or to the urgent care to sort of get a sense of whether they need to go, maybe we'll see a lot less of that use. So it's a very big conversation, Judy. I know we don't have time for it now, but the whole concept of whether care is being avoided or deferred is a really a big natural lab experiment that'll come out of the pandemic. And I think telemedicine can play a big role in helping to figure out how to maintain some of that positive change.
Well, that's great. I think that we'll have another test 6 months from now and see what's happened. So I guess we're out of time. But thank you very much. This has been a great conversation about the consumer and the post-pandemic consumer. Thanks a lot, Lauren.
You bet. Thank you.